Hello everyone, this is MBBS Gallery. Today our topic is bronchopulmonary segments. Let us move on to the topic directly. Bronchopulmonary segments. What is bronchopulmonary segments? They are actually a well-defined anatomical segments aerated by tertiary or segmental bronchus. So they are well-defined anatomical segments aerated by tertiary or segmental bronchus. These are pyramidal in shape, so it must have apex and base. So these are pyramidal in shape with apex directed towards the hilum, and this is the hilum. This is the hilum, also called as a root of the lung. Hilar structures are present here. So each pyramidal structure has its apex towards the hilum and its base towards the periphery. So these are pyramidal in shape with apex directed towards the hilum and base directed towards the periphery. Having the air, this is most important point, own arterial supply, but venous drainage is shared by adjacent bronchopulmonary segments. Okay, wow. Own arterial supplies are there, but there is no venous drainage separately for each lobes. This is an MCQs, will be asked in university. So then there are two lungs, as we know, right lung and left lungs. Right lung has 3 lobes and left lung has 2 lobes. So right lung 3 lobes are upper lobe, middle lobe and lower lobe. Upper lobe has 3 segments, middle lobe has 2 segments and lower lobe has 5 segments. Let us remember by APA, and this by LM and this by small p. So APA means apical, posterior, anterior. Here apical, this is anterior and this is posterior. This is called upper lobe, and this is middle lobe and this is lower lobe. Middle lobe has lateral and medial. This is a medial and lateral, and lower lobe has superior, medial basal, anterior basal, lateral basal, posterior basal. That's it. And left lobe, left lung has 2 lobes, upper lobe, lower lobe. Even though there is 2 lobes, the upper lobe is divided into upper division and lower divisions. Upper division has 3 lobes, apical, posterior, anterior, as it is in right lung, and lower division has superior lingular, inferior lingular, because a left lung has a structure called lingula. And then lower lobe has superior, medial basal, anterior basal, lateral basal, posterior basal. So for right lung and the left lung, their upper lobe, upper division structure and upper lobe structures, and lower lobe structure and lower lobe structures, both of them has the same one, and they are referred by medial lobe and upper lobes lower division structures. Due to the presence of lingula, they have superior and inferior lingular structures. And here we directly say it as a lateral and medial lobes for the middle lobe. And let us move on to the features. What are all the features of bronchopulmonary segments? These are well-defined anatomical, functional and surgical sectors of the lung. Each segment is pyramidal in shape with apex directed towards the root of the lungs. There are 10 segments on each side. Each segment has a segmental bronchus, artery, autonomic nerve and lymph vessel. Let us say one more time. Each segment has a segmental bronchus, artery, autonomic nerves and lymph vessels. There is no vein because each lobe is confined to its own bronchus, artery and nerves and vessel, lymphatic vessel supply, but the veins are shared between the adjacent bronchopulmonary segments. The segmental venules lies in the connective tissue between the adjacent pulmonary unit of bronchopulmonary segments. So that's why the reason placed here. During segmental resection, the surgeon works along the segmental veins to isolate a particular segment. So the surgeon works along the segmental veins to isolate a particular segments. So in relation to pulmonary artery, the pulmonary artery relations, and there is a pulmonary vein relation, and finally we move on to clinical significance. So relation to pulmonary arteries are the branches of pulmonary artery accompany the bronchi. The The branches of pulmonary artery accompany the bronchi. The artery lies dorsolateral to the bronchus. This is one mark question. We may confuse with vein structures. Let us see it in clear. The branches of pulmonary artery accompany the bronchi. The artery lies dorsolateral to the bronchus. Thus, each segment has its own. One second. The branches of pulmonary artery accompany the bronchi. The artery lies dorsolateral to the bronchus. So, thus each segment has its own separate artery. Then, relation to pulmonary vein. The pulmonary vein do not accompany the bronchi or pulmonary arteries. They run in the intersegmental planes. Thus, each segment has more than one vein and each vein runs more than one segment. Each segment has more than one vein and each vein runs more than one segment. It's an important point. Near the hilum, the veins are ventromedial to the bronchus. Okay. Due to vein as V, so ventromedial surface, and here arteries as A, so dorsolateral surface to lateral to the bronchus. So let us clear with this simple mnemonic. So then, clinical significance. Bronchopulmonary segments are independent functional unit of the lungs. So usually the infections of due to the independent functional unit, usually the infections of the bronchopulmonary segments remains restricted to it. But this is also, in some cases, there is an exception. In case of tuberculosis and bronchogenic carcinoma may spread from one segment to the another. So usually the infections of a bronchopulmonary segments remains restricted to it, although tuberculosis and bronchogenic carcinoma may spread from one segment to the another. Thank you.